Hi guys, this is Vamshi Krishna. Welcome to my YouTube channel. Today we'll see some of the basic questions for upcoming staff nurse examinations. So the first question is functions of placenta. So placenta is nothing but a protective layer of the baby in the mother womb. So what are all the functions of placenta? So let's see now. First one is a nutritive function. Nutritive function is nothing but giving nutrition. And the next one is a excretory function. Excretory is nothing but removing of waste products from the baby in the mother womb. And respiratory function. So what is the meaning of respiratory function? It is a diffusion of carbon dioxide and oxygen and other some gas exchanges. It is called respiratory function. And the final one is all of the above. So which is the right one? That is all of the above. So the placenta can be done nutritive function, excretory function and respiratory function. So these are the functions of placenta. So the next one is a function of prolactin hormone. So in the female, after the birth of the baby, prolactin hormone will be released. So what is the function of prolactin hormone? Options are milk production, milk secretion, milk ejaculation, and option D is A and B. So the right one is the option D, that is A and B. Those are milk production and milk secretion. For these two functions are responsible by the prolactin hormone, and milk ejaculation is based on the function of oxytocin. Okay, so based on the function of oxytocin, the mother can be I mean, the when the baby is sucking the mother's nipple at that time, during the nipple reflex, which goes to the hypothalamus, which secrete the oxytocin, so which leads to the milk ejaculation. And the next one is outermost covering layer of the heart. So what is the name of the covering layer? That is outermost. Outermost is nothing but middle to far. I mean, for example, if you think it is a heart, so this is the outermost layer, so which is cover the heart, and inside also there are different layers will be present. So here I am saying outermost, which is outside, which is present in the outside, that is called outermost, and innermost is the last one, which is present in the inside, that is innermost layer. So here is the question is, what is the outermost layer covering of the heart? The options are pericardium, myocardium, epicardium and endocardium. So the right option is pericardium. So the pericardium is a covering layer of the heart. So remaining layers are endocardium, that I'm saying from inside to outside, that is endocardium, and myocardium, epicardium. So epicardium will be present after the pericardium, and myocardium will be present after the epicardium, and endocardium will be present after the epicardium. So these are the sequence of layers of the heart. So the next question is, what is bathmotropic action of the heart? Okay, what is the bathmotropic action of the heart? Options are heart rate, excitability of the heart muscle, conduction of the impulses, contraction of the heart muscle. So which is the right one? The right option is the excitability of the heart muscle. So how it will be happen? Excitability by the taking of impulses from the pacemaker. So when the heart muscle is excited, okay, excited is nothing but taking impulses and become stronger or contraction, that is called bathmotropic action of the heart. So the next question is, pacemaker is located in which organ? Okay, pacemaker. So where we can see the pacemaker in the human body? Options are stomach, liver, heart, and bone. The right one is a heart. So if you think it is a heart, there are four chambers. Okay, this is left atrium, and this is left ventricle, this is right ventricle, and this is right atrium. So the pacemaker will be present over the sinus, SA, okay, sinus, which is present in the right atrium. Sinus is nothing but a oval shaped area, okay, some kind of oval shape, like a deep structure, so which is present over here. And here we can see the pacemaker. So what is the function of pacemaker? Which generate the cardiac impulses, okay, which generate the cardiac impulses, and it will transfer to the AV node and bundle of his and Purkinje fibers. So when the impulses are started, it will transfer to the all over the heart. So during the transportation of electrical impulses, what will happen? The cardiac muscle will be contracted. At the same time, the blood which is present in the chambers, it will go out. Okay. After that, remaining blood will be coming from atrium to ventricle. So that is a function of pacemaker, which is present in the heart. So the next one is the total duration of cardiac cycle. So if you think it is a heart, so when the heart is contraction and relaxation, so what is the total time of contraction and relaxation and conducting system, that is cardiac cycle? Options are 0.9 seconds, 0.4 seconds, 1 minute, and 0.8 seconds. The right one is a 0.8 second. So 0.8 seconds will be taking for the total duration of the cardiac cycle. So the next one is in ECG, P wave is stands for. So if you think it is a ECG, here we can see the P. So what is the meaning of P here? Options are ventricular repolarization, atrial depolarization, ventricular contraction, and atrial relaxation. The correct answer is atrial depolarization. So let's see what is depolarization and repolarization. So first one is a depolarization. So depolarization is nothing but it is a loss or lessen the electrical charge in the heart muscle. So here what I am saying, after the taking of electrical impulses, after taking the electrical impulses, and later for some time they will lose the electrical impulses. Why? Because the electrical impulses which will be pass over the all over the heart, that is atrium and ventricle. So the the absence of electrical impulses in the myocardium cell, that is called depolarization. And repolarization is nothing but it is opposite to the depolarization. So during this situation, gaining and receiving of the electrical charge, so in this condition the muscle will take the presence of electrical impulses is called repolarization, and the loss of the electrical impulses are called depolarization. So let's see some of the basic concept of ECG. So in the ECG, here we can see the ECG normal structure. So in ECG, what is the meaning of P wave? That is, P wave is the atrial depolarization. Here you can see. So depolarization is nothing but lessen the electrical charge. And the next one is the QR complex is the ventricular depolarization. So here you can see the here you can see the structure, that is Q or S complex. It is called ventricular depolarization. Here also the muscle is not not the presence of electrical impulses. Next one is a T wave. So what is the meaning of T wave? Here you can see T wave is nothing but ventricular repolarization. So here that heart has taken the electrical charge. So here I am saying the changes of the line P, Q, R, S and T. So let's see the gap between these three items. Okay. So in that P Q interval. So here you can see PQ interval. So that is called interval is the atrial depolarization and receive the electrical impulses through the AV node. So here what's happening in this gap, the heart is taking the electrical charge. Okay, so heart is taking the electrical charge, and the next one is the QT interval. So where we can see the QT interval from here to here. Okay, what will happen? Interval is the electrical activity of the ventricle. So here is what happening. The ventricle which are present in the lower chamber of the heart, which will be contracted. Okay, so which will be contracted by the receiving of electrical impulses. So the last one is a ST segment. So where we can see the ST segment here, ST. So in this segment, this is isoelectric. Isoelectric means there is no change of reducing, there is no change of increasing of the electrical impulses, that is called ST segment. So mainly in the ECG we have to observe the P wave, QRS and T wave. Okay, these are the changes, and these are the gaps, intervals. These are the changes and these are the intervals in the ECG. So this is the end of my class, guys. Thank you for watching.